So welcome everybody to our very first information management community practice for the education cluster. It's very exciting. A big thanks to Lauren Burns for setting this up. My name officially today is in fact Lauren Burns, as she's the one with the account for the GoToWebinar, but I'm Landon. And yeah, we're very privileged to have Patrice Chataigner with us today, who is an information analyst for ACAPS. Patrice was fairly recently in Syria and was involved with several needs assessments that took place in the north there. So today Patrice is going to present to us on some of the work that they did, and I hope we enjoy. Okay, Patrice, I turn it over to you.
Thank you, Landon, or Lauren. Thanks for inviting me and giving me the opportunity to present a bit on this initiative. What I will do today for this presentation that will last perhaps 15-20 minutes, I will present you the main objectives, challenges, and some of the results of the G1's assessment, and then from there we can take any questions that you have and discuss more in detail some specific issues if you have some. Obviously, the main problem in the case of Syria is to assess a country where you have a lot of fightings occurring since more than 2 years right now. Those red areas in the map are basically those places where frequent incidents are being reported based on the OCHA UNDSS database, where you have a lot of population displacement, and this is quite old data actually. We now know that there is much more than this and that it is going in every possible direction. Actually, if we wanted to map all of the displacement occurring right now in Syria, you wouldn't see the country which is behind the arrows. And on top of this, you have a lot of refugees who are crossing the border and being hosted in neighboring countries, as you may know. So the big challenge here is basically what type of assessment approach is relevant to this type of setting. What can we use as assessment tools? How can we organize ourselves to have information which is being gathered at a field level, which is being collected, which quality is being verified, and which is updated regularly, because as the situation is changing fast, what you need to have is more monitoring systems than a one-off type of assessment. So let's go through a bit the G1's methodology and how we have been approaching this particular setting. One of the key things that you can do generally in this type of setting is basically to do your main secondary data review. This is just one example made by OCHA from April 26, I think, which is a document of more than 20-30 pages, which is basically collating all of the information available from different sectors and putting it all in the same place. And this is the best that we had so far in Syria for the last 2 years. Basically a compilation of available information from partners willing to share their information on whatsoever. Problem being that most of the information being collected is anecdotal. At best is focused on areas where there is information coming out and is not really comparable over geographical areas or population groups or even sectors sometimes. So, but until now, or until December last year, actually, this one was of the best option, doing a giant secondary data review, making sure that all of this information floating around is being compiled, collated, aggregated, and analyzed. The approach we took in Syria and from Turkey basically was to build an assessment working group. This assessment working group was based in Turkey, basically in Antakya. In Antakya they have been, and there is still some NGOs who are working, who are able to do some cross-border operations from there. They are tolerated by the Turkish authorities. They are adopting a low profile also on the activities that they are basically implementing so far in there. But most of the NGOs who were there in January wanted to have a better understanding on what was happening in Syria, or at least in those areas that they were able to access from Turkey. One of the key things that you need to know about the assessment working group is that the assistant coordination unit from the rebellion was actually participating to this assessment working group. We'll come back to this point later. We, as ACAPS, we have been providing technical support to this assessment working group in the sense that we have been participating in the design phase, we have been drafting the tools, getting agreements about the key questions to be asked, designing the sampling methodology, ensuring that all the enumerators going to the field were being debriefed when they came back, doing some data cleaning, database setup, graphing, providing the analysis, ensuring joint analysis between the different partners, on basically producing the first draft of the report, which then has been validated by the assessment working group. One of the key points in the G-rounds was basically the ability to send people to the field. And this has been quite challenging. We will see after a while. This has been quite challenging because when we were going to those places where international NGOs or local NGOs were already working, it was quite easy to have a mix of enumerators who were either partners of some international NGOs, or to mix this with some teams or enumerators provided by the assistant coordination units. This was really feasible in the governorates of Idlib and Aleppo, for instance, where there is a strong humanitarian presence from international actors. In other governorates where this presence is less, where international humanitarian actors have not been reaching those remote areas, then we had to rely most of the time on enumerators coming from the assistant coordination units. I will explain you perhaps after what were the quality control procedures that we put in place to basically ensure that those findings or those results were considered reliable or not. Methodology, the primary data was collected at the sub-district level, which is a big change compared to the assessment methodologies which are available right now. For instance, the MIRA tells you go to the community level. We had to cover a huge geographical area. Basically, in the last rounds, we had to cover 8 times the size of Lebanon, for instance. So it was not possible to go at the community level. It would have been too time consuming. It would have been too resource intense. So we decided to get to one level up, which was basically the sub-district level. And we were able to cover 104 of the sub-district out of 150 in the 7 northern governorates, which is not a perfect result, not a good result, but a reasonably good result in terms of assessment coverage. We, of course, have taken into consideration the secondary data available. I've shown you an example from OCHA. ACAPS is also doing some secondary data review for Syria in a monthly basis. We have been able to compile all of this information which was available and to integrate it in the final assessment. And we also had to rely on the information which was made available by key partners operating in northern governorates. Those information, those assessment reports were not obviously available on the public space, but there were those assessment reports or those information that key partners of the assessment working group wanted to share. So this could fit into the analysis. Okay, you can see in the timeline that this is basically a process that took more than 2 months. This is the longest assessment exercise that we ever did, basically in the history of ACAPS, on, as far as I recall, in the history of needs assessment. The reason being basically the access and the security issues that we had on the field. So you can see that the field data collection took approximately 1 month to be completed. Some enumerators got back only after 1.5 months. Some enumerators got back after the assessment report was produced, basically. So, decision to be informed. I wanted to discuss a bit this point because any assessment needs to be designed according to its function. What are those decisions that needs to be taken? What are those decisions that needs to be informed? Are they a cluster strategy? Is this a flash appeal? Is this a consolidated appeal process? Well, the point for Syria is basically we didn't know what type of decision needed to be informed. Donors were quite careful in allocating funds. The SHARP was already produced, basically. And we were still at a stage where we were wondering what is happening in this area. Of course, secondary data reviews allowed you to gather those anecdotal information, but not in a way that would allow you to make a meaningful ranking in terms of severity or in terms of geographical area targeting or in terms of even affected groups targeting. So what we decided to do is to go as far as we could, and this was really the main point. So based from Turkey, basically sending assessment team in all of the areas which were accessible, where we could find reliable key informants, on making sure that those enumerators were able to get back in time to inform the report writing. And this is what we did in the first attempt. Basically, we made a first assessment in January 2013. We called it the GRANS 1, basically, and we were able to cover 58 out of 128 sub-districts for a total of approximately 34% of the total population pre-crisis in this area. In the second, GRANS 2, the one that was completed in April 2013, we were a bit better, we were a bit more comfortable, we had a better understanding on the security issues, on how to manage the enumerator. So we have been able to assess the situation in 104 of those sub-districts, which account for approximately 80% of the total population of those 7 governorates. Insecurity. Insecurity was a huge challenge for us. It was a huge challenge because you don't send somebody, you don't send an enumerator in a place where he doesn't want to go, which is also a source of bias. You're basically using some enumerators which are coming from a specific district or sub-district, and they want to assess the situation in their place of origin, which is understandable because for security issues they will know how to manage their own safety when they are getting in a place they already know. And they will also be able to cover the cost of the transportation. Transportation is quite expensive in the north of Syria right now due to fuel increase. So by using their network of friends, they were able to reduce the cost. Sending somebody in a place he doesn't know would actually call for an extra cost in terms of transportation for them. We lost people for some time. I mean, everybody get back safe. That's a good thing. But some of the team disappeared for more than 2 weeks, so we had some concern related to the safety of those enumerators that were sent for this assessment. Information scope. We had to cover a huge area. When you want to cover a huge area, you need to reduce the depth of information you are seeking. You need to reduce this depth because if you need to cover a huge geographical area, on top of this you have to fill a questionnaire of more than 12 or 15 pages, then the process can take more than 2 months. So here is basically the questionnaire we have been using in the last GRANS assessment, the number 2. This questionnaire is 5 pages. The questionnaire in the first GRANS was only 4 pages. And the questionnaire was quite homogeneous, quite consistent, quite robust. We learned from previous assessments. With the general section on damages, casualties, or people missing, level of electricity, the level of humanitarian access. Then some sectoral questions, basically health, food, wash, shelter and NFI, education and protection. And within each of those health sections, we were identifying the main problems or issues, the priorities in terms of intervention on group as expressed by the population. We were not calculating ourselves those priorities, but we were asking directly to the population, what are your main requirements in terms of assistance, or what are the groups facing the most risks today. The level of assistance, what kind of assistance was being provided on by who, if it was one-off or regular type of assistance. And the last thing we were asking was basically the severity. What was the severity of the situation on the life-saving scales for 4 of those sectors, basically. The process of building the questionnaire was not as difficult as it could have been in other contexts. Basically, in the assessment working group, there was a pretty good understanding that covering more geographical area, having an understanding about the variability of the situation in the 7 northern governorates was much more important than having too much detailed information. And this is also due to the fact that most of the humanitarian actors were operative in Idlib and Aleppo, but in this assessment we have been covering some geographical areas where we knew nobody would be active in the coming 6 months. So it was pretty easy to negotiate with the different sectors a pretty small questionnaire. Aiming at providing strategic overview, aiming at providing the big picture in the Northern Governorate, and not aiming at gathering programmatic type of information, not aiming at designing a project proposal. One of the other challenges was basically having access to this information that partners which are working on the do available in their organizations, but do not want to share. There is basically 3 reasons why organizations are a bit reluctant to share their information in this type of context. First is safety of their staff and security of their assets. Second is basically if you have a good information in Syria right now because you had access to a specific area, you would better put it in your proposal to ECHO or DFID or USAID rather than putting it in Relief Web. Third, because let's say that most of those assessments which are being carried out right now by organizations in Northern Syria are being made by local partners, and the quality of the assessment is quite low. It's from medium quality to low quality. So still, we wanted to have access to this information. We were not able to go in Syria and to participate to field assessments. So we wanted something to complement the information being collected by the enumerator. So what we did was basically to propose different NGOs to secure the information they would share with us. And this is what you have on the screen right now. This is basically a scale on which we are judging the information being provided, and this gives us basically an indication on how we should treat or deal with the information. Unprotected information provided by CARE or Save the Children, for example, is something we can easily quote and use quite publicly. Confidential information is an information that we need to anonymize, so nobody can trace the information back to the person who have been providing the information or back to the organization who have been providing this information. And it worked quite well. In the first GRANTS assessment, we were able to get more than 100 assessment reports. And this information proved critical in terms of comparing the result of the field assessments with the assessment reports available from different organizations. Some few results that came out the assessments. Theoretically, when we perform a rapid assessment, we are not able to provide population figures, but the methodology being used in the GRANTS allowed us to make some reasonable estimation of the number of people in those areas or the number of IDPs in which settings they were dispatched, and how many people basically were in those different places. I would not consider those figures as extremely accurate. That's not the point actually, but those are definitively figures we can work with. Obviously, the assessment was done in April. We are now beginning of July, so the situation has dramatically changed on the ground, and those figures are not anymore accurate, neither reflecting the reality. We were able to identify those areas where recurrent or frequent fightings are occurring. We were able also to identify the level of assistance being provided to those different areas in the Northern Governorate which have been assessed. We have been able to analyze the main component of humanitarian access. If you had some interference into humanitarian activities or some violence against relief agencies, some restriction of movements for relief agencies, presence of mines or unexploded ordnance, some active hostilities, or some direct restriction on obstruction to beneficiaries to access to aid. And this was quite interesting to analyze those results because basically there was more humanitarian access issues in areas of low conflict intensity compared to areas with higher conflict intensity. Severity of needs. was also computed based on the result of the severity ranking provided by the population. Prioritization as expressed by the population. We tended to rely a lot on this assessment on the opinion reflected by the key informants that were visited during the assessments. And this is basically some of the key findings. Health was coming first, followed by nutrition, food, wash, protection, shelter, education. All of those were mentioned as part of top 5 priorities in the visited areas. We were able to map the affected groups, which is one of the key findings, I think, because one of the reasons we couldn't assess the situation for different affected groups, such as let's assess the situation for IDPs in public building versus IDPs in host families. One of the reasons we didn't do that is that we had no idea how many of those groups were there. So we had to map them, and the results were quite consistent across the different exercises that has been undertaken by the assessment working group in Northern Governorate. We have 6 different affected groups. And you can see in the kind of heat map on the bottom right of the slide that IDPs are systematically mentioned as first priorities for receiving assistance by the key informants. And the last point is about the opportunities that assessing the same places at different moments in time gave us in terms of doing some trend analysis. This map is a combined map showing the areas that were assessed in January and in April 2013. So those areas which have a darker blue are those areas which have been assessed twice. It was quite interesting to see how the situation has evolved in those 59, I think, sub-districts in 3 months. Just in 3 months of time, the situation had completely changed. The situation had changed in terms of number of people, of number of displaced people. The situation has changed in terms of number of high conflict intensities being reported. The situation has also changed in terms of severity. It's a quite complex graph, but basically this is per governorate and per district, an indication of as the severity in food security or in public health, in water supply or in shelter and NFI, does the severity has increased or decreased between January and April 2013. And you can see that most of them has been increasing. Some of them also has been decreasing quite consistently, specifically, for example, in Deir ez-Zor. In Deir ez-Zor, which one part of the town is not being affected by the conflict, the situation has been improving because also more humanitarian assistance has been provided in the last 2 months. So this opportunity to basically use the same type of tool, use the same type of question for allowing trend analysis is quite important in this kind of context. I would say that this is even much more important than to have access to very much in-depth information when it comes to having a strategic overview of what's happening. And that's it for the main finding of the GRANs and for some aspects of the methodology. I would be happy right now to take some questions if you have some.
Okay, thanks very much, Patrice. I've got 3 short questions for you. The first one regarding the questionnaire. The form that you shared with us is in English. I was just wanted to ask whether you translated it into Arabic for the enumerators to take an Arabic version with them, or did they conduct it using an English questionnaire? Secondly, how many enumerators did you send per sub-district? And, you know, did you have a cut-off point regards how many came back for whether you thought, you know, that data was now valid? If you just got 1 back, were you able to use that, or did you make some decision that you needed at least 3 or 5 or so to make the data valid? And then finally, a question on the numbers that you quoted. I had a look in the report and it said something along the lines of you were quoting like numbers of people displaced per governorate, and there was numbers like 597,414, and then you put underneath, I think in the report it mentions an accuracy of between 4 and 8%. Is that normally how you'd recommend to do it, that you actually quote something like an exact figure or the figure that you think and then quote a level of accuracy? Because I mean, some people might put you know, 600,000, they might round it up. So would you recommend we give the exact figure we think is best, and then put a sort of estimate for its validity, or doesn't it matter? Is it just you could do either? Thanks.
Yes, excellent. Yes, we basically translated the questionnaire. We had a 2 days training with more than 70 enumerators, I think, in the last exercise. Half of them were also present in the first exercise, which was a good opportunity also to capitalize on what was already done. Sorry. And we conducted 2 days, I think, of pilot testing of the questionnaire, just to refine some of the questions. Even like this, we lost some of the questions specifically in protection, I think. When it came to very complex topics or sectors or very complex questions, which does refers to very occidental categories such as gender-based violence. Then there is some difficulties to operate in a country like Syria, which has no humanitarian background or presence or strong skills in terms of those specific sectors. So generally in the questionnaire, nutrition questions were not really well understood, on protection questions either. So this is for this question. Numbers of enumerators, as I mentioned, I think we use 77 as far as I can remember in the second exercise. As I mentioned also, some didn't come back, so I don't think they are counted in the final report, but they resurfaced after the report was released. The organization was this way. In each sub-district, we sent 2 people, preferably 1 people from the assistant coordination unit and 1 person from an NGO. So we were forcing a bit the different pairs. And those people were sent in 1 single sub-district where they had to navigate for as much as they could, basically. It could have been for 1 week, it could have been for 10 days. Some of them basically spent more than 15 days in their respective sub-districts. So from there, they were visiting as many villages as possible, interrogating as many key informants as possible, filling as many questionnaires as possible. But the key here was we did not have the capacity to deal with as many questionnaires as there was of community or villages visited or neighborhood visited. So basically what we have been asking to the enumerators is to summarize the situation at the sub-district level into 1 single final questionnaire. And this is what has been used by the HAM. Obviously, the level of bias, the level of subjectivity, the level of, let's say, also skills that we had available would potentially jeopardize such a system. So we made sure, I think, we debriefed more than 60 enumerators in the sense that we spent 2 hours, 2 hours and a half, sometimes 3 hours specifically discussing on the process they went through when they were visiting the communities. We wanting them to convince us that what was reflected in the questionnaires they were bringing back was actually reflecting the truth. Each time that a severity level of 5, which is the highest severity level, was reported, we were double-checking the information by independent sources, going through, calling some of the people or doing some verifications with other organizations. So even like this, I mean, being honest, the severity levels that were reported by the enumerator is not huge. You know, most of the areas visited fall under severity level number 3. And this is quite consistent with the information collected and analyzed through secondary data review, and this reflects also the opinion of the NGOs who have been participating to the joint analysis. So there is no extravagant findings out of the G1s too. How to discard the questionnaires? That's a good question. I remember in the first G1 we discarded 6 questionnaires. 6 questionnaires was considered completely unusable. In the G1s 2, I think we discarded more than 10, which is a good ratio for what we have been doing, I would say. But this is not the number of questionnaires we have been discarding. You can see in this questionnaire here that I have at the screen is that we have an evidence rating number. For example, for the population figures, for the damages, for the number of population, we are asking the enumerator to rate the level of evidence that he has. We are asking him to provide lists. We are asking him to basically provide some proof of what he's being reporting, specifically when it came to population figures. In Gerans 2, we said in the report that we assessed 11.4 million people, I think. Actually, we assessed 13.5. 2 million people are not in there because they fall in this evidence rating, which we are not able to tell if this is less than 50% confidence interval or more than 50% confidence interval. So we decided, and it's a bit of a drastic choice, we decided not to work with them. Now it's true, James, that you have some pretty accurate figure when we say, oh, you have 4,676,422 people in this area. It seems that we have been counting them door by door, you know, and that's not the case. Some of in the database, you will have some pretty reasonable estimates provided by local authorities. But from time to time, and I would say most of the time, local relief committees have been registering the population. So they have some pretty precise figures. So when you add up estimates plus precise figures, you come back with some decimals, which gives you a false impression of precision and accuracy. And yes, you need to be careful with that when you are reading the report. My suggestion when we are dealing with population figures is either you are sure of what you are presenting. For example, in the Gerans, I am sure of those figures with a confidence interval of 20%, I would say. So when I tell you that there is 1 million people are affected or at risk, in fact, I am basically telling you, yeah, there might be 800,000 or there might be 1.2 million. But this is reasonably good working figures, I would say. So if you don't have this type of information, if you are not able to back this up with proof or with reasonable evidence, I would suggest you work with intervals, not with point estimates. But you would say, okay, we are between, here in this place, we are between 40,000 IDPs and 60,000 perhaps, and that would be good enough. One last point on the population figures. I have been in charge of dealing with the population figures in both exercises, basically. The cost of having more precise figures in this type of assessment would be too big compared to the value of this information. Between April and now, the situation has already changed. More people have been moving. More people have been moving from one place to another, have been arriving into sub-districts, and more areas have been depopulated, while others have been receiving the bulk of the displacement. So if you would like to have more precise figures or to have more accuracy in the figures you are basically reporting, this would cost you much more than the actual practical value of those figures.
Okay, here's Marius has just submitted his question. Let me just read it. He says, his first question is pertains to the use of technology. Were they all paper questionnaires?
On the second question?
There isn't one yet, so maybe you could start with that one, and if there's
Sure.
more, he'll send.
Yes, it was a purely old-fashioned assessment for a very simple reason. Each enumerator would have been perhaps captured, or let's say would have faced problem at a checkpoint or when he was doing his work, and would have been found with electronic equipment such as a GPS or PDA or whatsoever. Might have been some problems. Well, now in the reality, they all have the last phone generation. You know, there is more iPhone there than there is in my city in Geneva. But basically, yes, we consider the paper was the safest way to collect this information. Plus, to be completely honest, we didn't have the time, neither the skills, neither the the necessary resources to put in place systems through phones or tablets or something like this. Electricity was a problem. So battery life would have been would have potentially jeopardized, the overall data capture if the enumerator was in a place where it did not have access to electricity for a while. And then after the transfer, basically we made the enumerators came to Turkey. They were trained. Then they get to their area. They spend there, I told you, sometime more than 10 days. Then they get back to Turkey to give us back the questionnaires. In the second assessment, in the case where it was too difficult for them to get back on time, I am specifically thinking of the people who have been to Teresor, which is the farthest governorate that we have been assessing. Then they were ensuring that they get to a location where they can scan the questionnaire and they can send it to us. If there was no scan, we were basically finding a way to call them or to Skype them so they can basically tell us what were the results.
Okay. His second question from Marius is how did you choose the key informants, or in other words, how did you instruct the enumerators to choose the key informants?
Okay. Basically, it's quite well structured. In each place, in each town, in each village, you will have a relief committee. We know this because we have been asking systematically who is intervening in this sector, what is the name of the organization, what type of support they are providing, is it a regular or the one-off exercise. This is this question here, for example. And this question comes back for every sector that we have been assessing. On local relief committees are definitely the more active people in each of those places. They are sufficiently well organized also to be organized at the sub-district level. Because they have basically been replicating some of the structure that was in place before the conflict started, or they have been building on the existing structure. So this is a place where you will find some figures. This is a place where you will find some lists of beneficiaries. I think in the result, I don't remember the figure, but there is more than 60% of the places where registration has been already done or is perhaps ongoing right now. So there is somebody who is basically taking the names of every IDPs or every person which is coming in the district. It's not comparable. They all have a different way of doing this, but they can show you something. And most of them are basically updated, so they are doing a pretty reasonable work on this. So the first thing for those enumerators was to identify those persons who are working in the relief committees and then to discuss for them, and then with snowball effect, basically to go to the next key informant and to ask the same types of questions and to repeat. Sometimes all the relief committees workers were in the same room answering the questions. Sometimes it was individuals face-to-face interviews being conducted. We also instructed them to go and visit some houses, visit some camps if there were some, visiting IDPs in public buildings, or to visiting the markets, for example. So as much as possible, key informant interview and direct observations. Then none of those enumerators has been following the same path from one place to another. Some of the enumerators were also kicked out from some areas because the population was complaining that no assistance was coming, so why they should give information if you were not coming with anything in your pocket to distribute to the population. So yeah, what we have been ensuring in the debriefing level was to ensure that, or to make sure that the enumerators has been doing as much as he could, or all the efforts possible, to discuss with as many people as possible, to visit as many places as possible, to discuss with as many different minorities as possible, to ensure that what was reflected in the questionnaire was a good average of the situation in this sub-district. So checking on the variability. Questions such as who have you been discussing with? How many of those people have you been discussing with? How many places, different places have you been visiting? Where have you been? Show me on the map. Where were the checkpoints? Where were the issues? Where is there any minorities in there? Have you been able to meet those minorities? You're telling me that there is some IDPs in public building. Have you been visiting those communities? What were the status and conditions? Could you explain me more on this? So yeah, the debriefings were quite extensive. They were quite pissed off. We were asking those types of questions basically, but in this type of assessment where you need to do this remotely, you don't have more or very different ways on checking on the quality of the results. Over to you.